Hey, Margie here. Hyperthyroidism is a root cause of osteoporosis, and most of us don't realize that there are natural treatments that can be used to help this condition. And our special guest to delve into this with us today is Dr. Eric Osansky. And Dr. Eric is a chiropractor, clinical nutritionist, and a certified functional medicine practitioner who has over 20 years of experience in health and wellness and has been helping people with thyroid and autoimmune thyroid conditions since 2009. He's the author of the books Natural Treatment Solutions for Hyperthyroidism and Graves Disease and Hashimoto's Triggers, and is the host of the Save My Thyroid podcast. Dr. Osansky was personally diagnosed in 2008 with Graves' disease, and after taking a natural treatment approach, has been in remission since 2009. After seeing how well natural treatment methods helped with his conditions, he began using this natural thyroid treatment protocol to help others with different types of thyroid and autoimmune thyroid conditions, including hyperthyroidism and Graves' disease and hypothyroidism and Hashimoto's thyroiditis. And in today's episode, Dr. Eric talks about the different testing for the thyroid and what these natural treatments entail and how they can be so beneficial. So, lots of great information. Stay tuned. Welcome, Dr. Eric. I am so happy to have you here on the podcast because this topic is really important for this audience. It's interesting. A very close friend of mine during COVID was misdiagnosed and she had hyperthyroidism, but her only symptom at that time was her eyes were itchy and bothering her. And guess what happened? She lost a tremendous amount of bone. She lost bone during that time because of this. So there's such a relationship to osteoporosis. And I'm just excited to share all your wisdom with everyone. So welcome.
Well, thanks, Margie. I'm excited to be here and talk to you about hyperthyroidism.
So let's just, I always love to talk about the backgrounds. Like, how did you end up specializing in this? So you want to share a little bit about your story, why you're so passionate and why, about this topic.
Sure. So my journey began in 2008 with regards to hyperthyroidism. I was dieting, I was doing things for detoxification, and I was losing weight, which at the time was my intention. But I didn't realize that eventually some of the weight loss was due to elevated thyroid hormone levels. And, I was, and one of the big reasons because I was losing a lot of weight. When I started dieting and detoxifying, I was 182 pounds, which was like the highest I've ever been. And then I dropped down eventually to 140, which is a huge difference, 42-pound loss. And so I had increased appetite and started having palpitations. But really, honestly, even before the palpitations, I didn't really I didn't know the consequences until one day I was walking in a Sam's Club, and you know how they have those automated blood pressure machines. I sat down, took my blood pressure. My blood pressure was fine, but my heart rate was elevated. It wasn't too bad, but it was like 90, which for me and I mean the average person, 90 is pretty high. And so when I got home and for the next few days, I would just manually take my resting heart rate and it was anywhere between like 90 and 110, and that's where I suspected something was wrong. So I ended up going to a primary care doctor who did some initial blood tests, diagnosed me with hyperthyroidism, and then a few months later, I ended up seeing an endocrinologist who diagnosed me with Graves' disease. And at that point, I didn't have much experience dealing with Graves and hyperthyroidism, Graves' disease, but I did know I was going to take a natural approach. And the reason for this is because as a chiropractor, I needed continuing education credits, just like most healthcare practitioners. And always focused on nutrition. And I actually took a few endocrinology courses, like functional endocrinology seminars, I guess they were. And so I knew that I was gonna at least try to tackle it naturally. I didn't know if it would work because again, I was my first my first patient, my own case. Yeah. So long story short, I took a natural treatment approach, changed my diet, did things to manage my stress, took some supplements, and over time was able to get into remission. And that was 2009. And ever since then, I've been able to maintain a state of wellness and have been working with many others who have hyperthyroidism.
Oh, I love that, and we're gonna explain the difference, but I just have to tell you, my mother had hyperthyroidism. Back in those days, she was treated with iodine, and it just wiped out her thyroid, so she was just on medication the rest of her life. But I had Hashimoto's. My whole family did, prior to this, have thyroid issues ran in the family. And so, the minute your blood work shows, they put you on Synthroid. And this is before I went back to school for health coaching. And when I went back, I'm thinking, I started making some changes in my diet. And guess what? I was able to, and lifestyle too, I was able to totally get off medication. And that's been since 2011, been off all my thyroid medication. And I was on Synthroid. So yeah, so it's just so powerful. So why don't you, and it is possible, in the past when I heard that people got off, I'm like, really? Like, why don't you share, just explain the difference between, hyperthyroidism and hypothyroidism? Because I'm not sure that people really, everybody understands the difference.
Sure. So hypothyroidism is definitely more common than hyperthyroidism. And with hypothyroidism, you have low thyroid hormones. So the main thyroid hormones are T4 and T3, at least the ones that can be tested on the blood. There's also T1, T2. We still don't have full understanding of those. And then there's TSH, which is thyroid stimulating hormone, which is more pituitary hormone. So with hypothyroidism, again, the thyroid hormone levels are low, so you'll see T3, T4, and they might be within the lab range, but on the lower side, so they might be more subclinical. TSH, same thing with thyroid stimulating hormone. Sometimes it's above the lab reference range, sometimes it's a little bit above optimal, but essentially what hypothyroidism, TSH is on the higher side, thyroid hormone levels on the lower side. And because thyroid hormone's lower, you'll get common symptoms such as fatigue, brain fog, coldness, constipation, brittle hair. Those are some of the common symptoms. And then with hyperthyroidism, it's the opposite. So you have an elevation of thyroid hormone. So T3, T4, typically high on a thyroid panel. TSH, thyroid stimulating hormone, is low or in many cases depressed, undetectable. And reason for that is because the pituitary is trying to signal to the thyroid gland not to make any more thyroid hormones. So that's why you get undetectable TSH in many cases. And because the thyroid hormone is elevated, some of the symptoms people experience. I mentioned the weight loss because of increased metabolism and heart palpitations, tachycardia, which is increased resting heart rate, sometimes loose stools, anxiety, insomnia. So those are the classic symptoms. I will say some people don't have classic symptoms. Like I work with people sometimes who are gaining weight for other reasons rather than losing weight. But what I just mentioned were the classic symptoms. So yeah, those are really the some of the main differences between hyper and hypo. And I should add, you mentioned your friend's story with the eyes, and so most thyroid conditions are autoimmune. So most cases of hypothyroidism are Hashimoto's, and most cases of hyperthyroidism are Graves. And a lot of people with Graves disease have what's called thyroid eye disease, which affect the eyes. So that could be another potential symptom, not necessarily of hyperthyroidism itself, but of Graves due to that autoimmune component.
Yeah, it was so sad that it was missed because it was during COVID and people weren't seeing people in person. And she would go to the ophthalmologist, and they just didn't think of doing, looking deeper than the eyes, just putting her on some steroids and different things. So it was very unfortunate, but, now she's doing pretty well, but anyway, yeah, so it's something that in terms of the testing, oftentimes they'll just do a routine screening of, like, TSH. What's your recommendation when people are getting their blood work? You have, in terms of what they should be getting in the thyroid panel.
Sure. So yeah, TSH, unfortunately, like you said, a lot of times it stops there. And then there are some practitioners that look at TSH and T4. So I recommend TSH and the free thyroid hormones, free T3, free T4. I mean, people could do the total T3, total T4, the total thyroid hormones. I think in hyperthyroidism doesn't make a big difference. Usually, if one's elevated, the other is going to be elevated. And then the antibodies, I want to see thyroid stimulating immunoglobulins are the antibodies associated with Graves' disease. But a lot of people with Graves also have thyroid peroxidase antibodies, TPO antibodies, which are common with Hashimoto's as well, and then anti-thyroid globulin antibodies, which are more closely associated with Hashimoto's. Again, some people with Graves also have those, but it's also important to go a little bit beyond that. Like with hyperthyroidism, you could have uh, elevated liver enzymes. So look, and we're going to talk about like alkaline phosphatase relating to the bone. So doing like a comprehensive metabolic panel, doing a complete blood count. Is also with differential. So there's a number of different tests, and we could go as deep as you want in the testing. But as far as the thyroid panel, it's typically TSH, free T3, free T4, looking at antibodies. There is a marker you might be familiar with, reverse T3, that sometimes I get asked about. With hyperthyroidism, just about everybody has an elevated reverse T3. Uh, so it's not providing the same value as it is with Hashimoto's or, hypothyroidism. So I used to test that in most people, but then I realized it's not really giving me value. It's not changing the way I address the hyperthyroidism. So I no longer test for reverse T3 in people with hyperthyroidism.
I know there are a couple there's not just Graves' disease. You wanna just share what other conditions are under that category of hyperthyroidism?
Sure. So, in addition to Graves, there's what's called toxic multinodular goiter. So, multinodular goiter is when you have multiple nodules in the presence of a goiter, which essentially is a swelling or enlargement of the thyroid gland. The toxic part relates to the hyperthyroidism. So, it could be for a few different reasons. One reason is that the nodule itself could be stimulating the production of thyroid hormone. And sometimes people will have antibodies, like they'll have Graves and in the presence of a toxic multinodular goiter, and then it's hard to differentiate. Is it due to the nodules producing thyroid hormone? Is it due to the Graves? But that's a second type of hyperthyroidism. There's subacute thyroiditis, which is typically caused by a virus and is usually transient, where someone will become hyperthyroid for a few weeks to a few months. Then they'll usually make a transition to hypothyroidism temporarily, and then usually become euthyroid, which means the thyroid hormone levels will normalize. There's hashitoxicosis, which is essentially Hashimoto's with transient periods of hyperthyroidism. As the thyroid gland gets damaged, the thyroid hormone could rush into the bloodstream, presenting as hyperthyroidism, not only symptom wise, but even on a blood test. And then there's subclinical hyperthyroidism, where someone would have a depressed TSH, but their thyroid hormone levels look perfectly fine. And every now and then there'll be subclinical Graves where they'll have depressed TSH, elevated thyroid stimulating immunoglobulins, and their thyroid hormones will look okay.
Okay, so let's now bring this home to bone health because it really is something that has a huge correlation and people can be losing bone because of this. So why don't you explain how this affects our bone density and what's going on there?
Of course. So thyroid hormone is important for, I mean, it pretty much affects every cell tissue in the body, including the bone. So it does play a role in bone remodeling and bone turnover. And so you don't want thyroid hormone level to be too low because that could affect the quality of the bone remodeling. But you also don't want the thyroid hormone to be too high because it could accelerate the bone turnover, the bone remodeling. And over time, that could lead to decreased bone density, osteopenia, even osteoporosis. So essentially, that's how it's affecting the bone. And I mentioned earlier, there's a marker called alkaline phosphatase, and alkaline phosphatase could relate to the liver, but could also relate to the bone turnover. And so, when looking at a comprehensive metabolic panel, or you could also, I don't do this, but some practitioners will test. There's like isoenzymes of alkaline phosphatase, where you can look specifically at the isoenzyme associated with the bone and the liver. But usually it's associated with the bone and hyperthyroidism. So if you look at alkaline phosphatase, and many people will be under 100, whereas like in hyperthyroidism, it might be 200 or 300 or 170, but either way, it's commonly elevated. And in most cases, that's due to the turnover, the increased turnover of the bone. And yeah, so that's why it's critical to lower the thyroid hormone levels. I mean, it definitely puts stress on the heart. Like when I was dealing with hyperthyroidism myself, I honestly wasn't thinking about my bones. I was thinking more about the heart. And that's what most people think. Oh, my heart rate is high. I don't want to have like atrial fibrillation or, develop any arrhythmias. But one thing a lot of people don't think of is the impact it has on the bone. And if you have unmanaged hyperthyroidism over time, as I just mentioned, it could lead to osteopenia and in some cases even osteoporosis.
Yeah, no, it's definitely a risk factor. And so when someone and it's just so important that it's checked. And if you're getting, it's great. A lot of people want to lose weight, but this is serious weight loss. It just keeps coming off. And, this is something we don't want. And so, you mentioned that you were able to treat this with alternative treatment. So if someone is diagnosed, what is your recommendation then? Or what are options? Because, usually they'll be put on some type of medication to immediately, stop what's going on.
Yeah, so just as is the case with Hashimoto's, I mean, there are some people that need thyroid hormone replacements. So you gave your story where you took Synthroid, and thankfully you were able to, get off the Synthroid and haven't taken it for many years. With hyperthyroidism, some people do need to take antithyroid medication. Now, when I dealt with Graves, I took an herbal approach just because I learned about it years back. And like I said, I didn't know if it would work because I was my first patient, but the herbs that I took, one of them is called bugleweed, which is an herb that has antithyroid properties. And then I took one called motherwort, which is an herb that affects the cardiovascular system. So I took bugleweed and it was helping, but I was still having heart palpitations. So that's why I added motherwort. L-carnitine, I'm sure you're familiar with L-carnitine. The research shows in higher doses, like 2,000 or 4,000 milligrams, it could actually block thyroid hormone. So that also is something that some people could consider. There's lemon balm, which has more of a calming effect. Lithium, not prescri- I mean, well, prescription lithium, like lithium carbonate, will definitely lower thyroid hormone levels. But from a natural standpoint, there's lithium orotate that could also be beneficial. But like I said, some people do need to take antithyroid medication such as methimazole. Some cases, there's something called PTU, which people will take. The problem with the antithyroid medication, side effects are common. So it could elevate liver enzymes. It could depress white blood cell count, which are additional reasons why you want to look at a metabolic panel as well as a CBC to see how the medication is affecting the liver, affecting the white blood cell count. Uh, there's there are other options like LDN, low dose naltrexone, which I'm sure you're familiar with, not just for Graves, but for other autoimmune conditions. Hashimoto's modulates the immune system. Just I find that's more hit or miss. The antithyroid medication works most of the time, if not all the time. It's just that side effects are common. So if someone is working with me and they're not doing anything, I'm definitely open to them taking the herbs. Why not start with the herbs if you're not taking anything? But it gets more challenging if someone's already taking the antithyroid medication, and if they're tolerating it, because if they're tolerating it, we don't know if they'll be okay on the herbs. And what I mean by that, I'd say like 70-75% of people are able to manage their hyperthyroidism effectively with the herbs, but that means that there's about 25% or so that aren't able to manage it effectively. So, I mean, I don't have prescribing rights. So even if I wanted to, I can't tell someone to stop taking the meds. But even if I did have prescribing rights, I don't know if I would do that because in some situations, people would, if they stop taking the meds and switch to the herbs, they might become hyper again. So that's a little bit of a challenge, and sometimes we'll have people do both. If they're taking antithyroid medication, they wanna make that transition, they could take the bugleweed at the same time or, maybe like an hour apart. Usually, I have them take it away from the methimazole, but then as their numbers start creeping more towards the hypo side, then hopefully the prescribing doctor will reduce the dose of the antithyroid medication, and then they can rely on the bugleweed, and then eventually get off the bugleweed. I mean, I haven't been on bugleweed or motherwort since 2009, so those are also temporary while you're doing things to address the cause of the problem.
Oh, that's so great. So is there a time so I think it's important that people work with a practitioner because you can't really am I right about that? You really can't play around with this yourself. You really need to be tested and followed. Do you agree with that?
I mean, ideally, yeah, I would say yes, but and I smile just because you know how it is. I mean, people could get supplements that just they're readily available. So I see people all the time who have been trying to self-treat their condition. They've purchased bugleweed on the internet or motherwort, and yeah, so it is a complex condition, and a big thing you want to be safe while trying to address the cause of the problem. So yeah, I would say in a perfect world, you would want to work with a practitioner to help you and not self-treat it.
Or at least get your levels tested on a regular basis. So you're not, you're not causing it to go too much or, so that everything and that's sort of what happened to me. All of a sudden, here I am changing my diet and not I didn't do that much, but I really changed, certain processed food I was having. I just changed and I just added a lot more vegetables and did a couple things and I got rid of dairy for me. And all of a sudden my heart starts, racing. And I called the endocrinologist, and they're like, cut your medication in half. That was the step one. And then afterwards, it was okay, and then she happened again, terribly. She's like, "Just get off it," So I see what you're saying, like, if you're doing things and it's even what I've seen with people, my brother had hyperthyroidism and just reducing his stress completely, he was able to get off all his medications. So what you're saying with lifestyle and other things can make such a big difference. That's so int but how many years? Is there a period of time where if you've been on the thyroid medication, you're doing well, and you try some of these herbal or lifestyle changes, is there a period of time where, it's just too late to reduce medication? What have you found?
So with Hashimoto's, sometimes that's the case because the thyroid gland is slower to regenerate. So if someone has been dealing with that for a long time and there's significant damage, they might need to be on thyroid hormone replacement, maybe permanently, but maybe just for a prolonged period of time. With hyperthyroidism, it's not really causing damage. It's more stimulating the immune system. Like the what happens at TSI, the thyroid stimulating immunoglobulins, attack or bind to the TSH receptors. But from what I understand, not really causing damage. So regardless of whether someone has hyperthyroidism for 2 months or 10 years, it doesn't mean that they can't get off the medication. I mean, I will add that a lot of endocrinologists don't want people on the medication for longer than 18 months to 2 years. And then at that point, they might recommend radioactive iodine thyroid surgery, even though there are a number of different studies that show that low dose methimazole is safe. So there are people that have been taking it for 5, 10, 15 years. Again, it's not the ideal situation. Ideally, you'd want to get a remission and not have to take that at all. But if you're weighing risk versus benefits, taking 5 milligrams of methimazole or getting your thyroid removed or obliterated through radioactive iodine, which did you mention was it your father that had that
My
son?
mother had that
Your
many,
mother.
many, many she's not alive anymore, but many years ago, and it was tough. It was, then she had medication, which she was fine, but it took maybe 2 years
Yeah.
for things to sort of, get in sync, but yeah, that was the treatment. That's what that was the options
Yeah.
back then. Yeah.
Yeah. It still is. It still is a common option. And unfortunately, a lot of medical doctors resort to that real quickly. And then again, some will say, well, take the medication and they're not doing anything for the cause of the problem. So the person might get into remission temporarily and then relapse. And then they'll say, get radioactive iodine or thyroid surgery. So again, I'm not saying there's not a time and place, especially for surgery. Some people do need to get surgery, but it should be a last resort. And yeah, what you said is absolutely right about the stress. And I mean, diet and stress, obviously, people can do on their own. It's not like they absolutely have to work with a healthcare practitioner. Your listeners could do things and hopefully are doing things now to improve their diet and manage stress. But if not, that's something they could do. But yeah, when it comes to just trying to find, remove triggers and even manage your symptoms, it's not a bad idea to work with a practitioner.
I know in your book you have a lot of different things that people can do, but what have you found, in terms of we talked about, the herbs and reducing stress. What have you found? You said I think it's so important. I'm a big believer and you have to get the root cause. That's just so critical because really nothing gets better. You're just mad, until you do that. So what are some of the root causes that you were alluding to?
So stress definitely is a big factor. And I should mention in my case with Graves, stress was a factor too, but it wasn't just emotional stressors. I was overtraining. So while I was dieting and detoxifying, I was also overtraining, and I'm sure that was at least a contributing factor. Again, diet, gluten and dairy, which you mentioned earlier. I mean, those could be potential triggers. And even if they're not direct triggers to the immune system, they could increase permeability of the gut, which could set the stage for autoimmunity. And then there's environmental toxins. Just in this day and age, we're exposed to heavy metals and all these xenoestrogens that could disrupt not only thyroid but also affect the immune system, and just an endless array of chemicals, and then certain infections. So you mentioned COVID. So COVID, definitely when COVID hit, I saw an increase in hyperthyroidism, Graves disease, and then other viruses like Epstein-Barr. There's research showing that a relationship between both Graves and Hashimoto's and EBV, certain microbes in the gut. So H. pylori, I mean, there's controversy whether it's pathogenic all the time, but regardless, sometimes it can be a factor in the development of Graves and Hashimoto's, parasites as well. So yeah, those are the main categories: the food, the stress, the potential infections, the environmental toxins. And those are really the main areas that I focus on. I mean, not everybody has not everyone has an infection, but arguably everybody, we need to support the gut in everybody. You need a healthy gut to have a healthy immune system. So for anyone with Graves, Hashimoto's, we're doing some type of offering some type of gut support. But yeah, those are some of the more common triggers. And one other thing, nutrient deficiencies, which I don't know if I'd really consider a trigger, but being deficient sort of nutrients like selenium, is very important. I mean, all the nutrients are important, but some are more important than others. Vitamin D, a lot of you listeners, I'm sure, especially when it comes to bone health, are familiar with the effects of vitamin D. But besides the importance of vitamin D with bone health, it also is anti-inflammatory, and there's a lot of research showing that healthy vitamin D levels could benefit autoimmunity as well.
It's so interesting because all the things you're saying are also root causes of osteoporosis. So, the body is not so separate where it's going to affect your thyroid and not your bones. And when you address these, really everything gets better, which is so wonderful. But you mentioned selenium. Do you recommend people? I know a lot of people suggest, eating like 2 Brazil nuts a day. I mean, is that in terms of having adequate selenium? Do you have any recommendations on that?
Yeah, well, I'll say that these days, like under a state of wellness, I eat Brazil nuts usually a couple a day. I get like organic Brazil nuts from Costco. But when trying to correct deficiencies, usually I recommend supplementation just because you don't know how much selenium is in a single Brazil nut. It could be 10 micrograms, could be 80 micrograms. And usually I'm recommending 200 micrograms, sometimes more than that, trying not to go too high because of selenium toxicity, but let's say 2 to 400 micrograms. And so with a Brazil nut, if we tell someone to eat 2 or 3 Brazil nuts, they might be getting the 200 micrograms, but they also might only be getting like 30 micrograms, depending on the Brazil nut that they're eating.
Yeah, that's so interesting. And so in terms of, I love your approach. Tell us about your book though, because that people can sort of read and adapt. Just share what's in the book because you just came out with a new edition. So why don't you tell us about that?
Yeah, thank you. Thank you for mentioning that. So yeah, in 2011, I came out with the first edition. It's called Natural Treatment Solutions for Hyperthyroidism and Graves Disease. 2 years later, I came out with the second edition, and then actually I started working this year on a new book, a brand new book related to hyperthyroidism and the diet. But then I was skimming through the second edition of the book, which again I wrote 10 years ago. And I'm like, this really needs updating. So I put the new book on hold and I just updated the third edition. So that's available on Amazon, Barnes and Noble. And I'm also putting the finishing touches on an audiobook of the third edition. So I don't know if it'll be out at once this is live, but it'll be out soon. If it's not out by the time this is live on, then it'll be probably like within a few weeks. So I'm excited about that. That's my first audiobook ever put together. And then, yeah, in the near future, there should be another book on hyperthyroidism more related more to focusing more on diet. There's a chapter in my third edition that focuses on diet, so it definitely gives a good amount of information with diet and stress management. Talks I mentioned infection, so we talk about some of the common infections that could impact hyperthyroidism, and just of course talk about certain supplements as well. I mean, there's like 30, I think there's 32 or 33 chapters. So there's a lot of information in that book. So obviously, if anybody listening has hyperthyroidism, I recommend it. I think that you'll benefit from it. And if you don't like to read, you could listen to the audiobook.
Yeah, that's great. I'm a big audiobook person only because
Same
I do a
here.
lot of driving into New York City and back, and I've gotten so many books, I just devoured book after book on the audio, it's great. I mean, I read as well, but it's sometimes for a lot of people who are busy, you just can turn it on when you're in the house, when you're
I
so,
agree.
I mean, sometimes I like some fun stories too, but it's good to get get the information. Well, what really changed in the past couple of years that you had to update it? What were the latest what were the new things that you felt you needed to put in? What's
That's a great question. So I'll say one of the big changes is there's a chapter on iodine and hyperthyroidism. And so there's a lot of controversy when it comes to iodine and thyroid health in general, not just hyperthyroidism, but Hashimoto's as well. So when I was learning about thyroid health prior to hyperthyroidism, like attending those functional endocrinology courses, they were very pro iodine and talking about taking high dose iodine, regardless if someone has Hashimoto's or hyperthyroidism. So when I dealt with Graves, I was doing that myself, and I did okay. I did fine with high dose iodine. I did a urinary test for iodine and took iodine. And I don't know if you're familiar with Dr. David Brownstein, who's he's written a book,
yeah.
Iodine: Why You Need It, Why You Can't Live Without It. So I was following like his recommendations, and but just over the years, I realized not everybody does well with iodine, especially high dose iodine. It could exacerbate autoimmunity. It could exacerbate hyperthyroidism. So so if you read the 2013 edition, the second edition of the book, again, I was more pro iodine, whereas now it's not that I'm anti iodine, but I'm more cautious. So people could read the second edition and get the impression that I want them to go out and test for iodine and take iodine. And so, but yeah, so that's no longer the case where like someone I work with where I have them do urinary iodine testing off the bat and have them supplement with iodine. So that was one of the big differences. I mean, there's others like there's a medication called cholestyramine, which they use for mycotoxins. There's a few different purposes, but it also binds to mycotoxins, so they use it with toxic molds. But then there's some research that shows that it could bind to thyroid hormones. So if someone is unable to tolerate methimazole, the anti-thyroid medication, and let's say the herbs aren't effective, again, usually the next step would be surgery or radioactive iodine. But there's cholestyramine. So that wasn't in the 2013 edition. Low dose naltrexone is another option, which I did talk about back then, but went into a little bit more detail. So just things like that. There's new supplements like berberine and alpha lipoic acid. There's been research recently on how they could help with thyroid eye disease by modulating the gut microbiome. So that is something I didn't know 10 years ago. So that's something that's in the book. So yeah, just little things like that. I mean, if someone is listening and they have the second edition of the book, I would still say it's extremely valuable. A lot of people have, gotten tons of value from the book, but it was just overdue for an update.
Oh, wow, that sounds great. It's very interesting with the iodine because I had Dr. Alan Christensen on the podcast, and, as I said, even though I'm totally fine, I still have thyroid antibodies that are elevated. Even though, from Hashimoto's, even though I have no symptoms other than that, and my blood work is great. And so, anyway, I said, "You know what?" Because he talked about for Hashimoto's that could be an issue, too much iodine. And so I said, "You know what? I'm gonna" and I was eating a lot of sea vegetables, I guess, I was putting the dulse on all my food. And I said, "You know what? I really do have a lot." So cut back, and guess what happened? The only thing I did, way reduced. My thyroid antibodies were so much lower after that. was so interesting. So it seems like there's certain people with Hashimoto's that just like you say, it is an issue, and I think that's such a good point that you brought up because you will see, people recommending iodine to everybody, and, yeah, it was very surprising that it really made a big difference in my thyroid antibodies, so
Yeah. I mean, that's
yeah.
something I'm pretty sure I mentioned in the book too, the sea vegetables. So I don't tell people to avoid iodine. I know Dr. Allen's not saying that too. I know pretty sure he recommends like 200 micrograms or less, which again, some people definitely benefit from that real low iodine diet. But when it comes to, yeah, sea like kelp and seaweed, definitely people could overdo it. And then the supplements, there are supplements out there which, are where 12.5 milligrams, like a single capsule or tablet, and people could overdo it that way too. So yeah, that's great to hear that reducing the sea vegetables helped with those antibodies. So.
Yeah, it was just so very interesting. Because and so tell us about your podcast, because 'cause I've been a guest on that, and you have all sorts of interesting topics. Why don't you just share a little bit about that?
Yeah, yeah. As you said, you are a guest, and I plan on having you back on the. It's called Save My Thyroid, and so Save My Thyroid. It The focus is on people with hyperthyroidism and Hashimoto's, helping them to save their thyroid. Because when it comes to hyperthyroidism, obviously people need to save their thyroid from radioactive iodine thyroid surgery. But with Hashimoto's, you get the damage from the immune system. So people want to do what you did. They don't want to just rely on Synthroid the rest of their life. They want to do things to improve the immune system health. So yeah, I have a lot of guest interviews, which could benefit most people with hyperthyroidism and Hashimoto's. And then I have some solo episodes, which also usually could benefit both, but there is a little bit more of an emphasis on hyperthyroidism with some of the solo episodes, just because most of the thyroid related podcasts focus more on hypothyroidism and Hashimoto's. So I wanted to have a little bit more of a focus on hyperthyroidism. So, but yeah, there's a lot of great topics. Of course, you spoke about bone health and, just people talking about infections and toxic mold and estrogen metabolism and other hormone related topics. So yeah, a lot of good conversations on there.
Well, I just love this because I love to expose people to what's possible. Because oftentimes we don't know there's another option, or again, you don't want to ignore this. You certainly, as you said, there's definitely a place for medication, but the fact that you could be on your medication and try the other things and look at your book and see other options that can help you. Like, I mean, I had the hypothyroidism and Hashimoto's. However, I didn't know that it was possible. So and you're a walking example and all the people that you've worked with that so much can be done.
Yeah,
S
it's been a pleasure working with people with just because there's not a lot of people out there, a lot of practitioners out there with hyperthyroidism. So it's just obviously I wouldn't be one of them if I didn't deal with it myself. But still, there's a lot of even though there's not as many people with hyperthyroidism as there is those suffering with Hashimoto's. There's still a lot of people out there, and so I'm grateful that I have the opportunity to help so many people with different types of hyperthyroidism.
Yeah, and as in this community, as you explained, it's something you totally need to address because it is a root cause of osteoporosis, and it's something that absolutely has to be dealt with. So we could go on for a long time. Is there any last minute things you want to share before we end?
Just remember that there's always hope. So, again, there's a time and place for medication, time and place for, in the case of hyperthyroidism, surgery, thyroid surgery. But again, most people, they can restore their health. Same thing with, as you educate people with osteopenia, osteoporosis. So, if it's associated with hyperthyroidism, same thing. You got to address the cause of the problem. You don't want to rely on just like the medications for osteopenia, osteoporosis. You want to address the cause. So in this case, we're talking about hyperthyroidism. So definitely, yeah, consider working with someone. But if not, you could definitely start by checking out my book, my podcast. Again, Save My Thyroid, SaveMyThyroid.com is the website associated with that. And I guess that's it. And thank you, Margie, for the opportunity to educate your listeners about hyperthyroidism.
Oh, okay, and the last thing then, I'll have all the links in the show notes, but the website is the same thing, correct? The website? What website
Actually,
should they go to?
I have 2 websites. So my original website, naturalendocrinesolutions.com. So if someone's more of a reader, I have hundreds of articles and blog posts on both Graves and Hashimoto's. And then Save My Thyroid, when I launched the Save My Thyroid podcast in 2021, I rather than put on naturalendocrinесolutions.com, I figured I'm gonna have a whole brand new website, savemythyroid.com. So I have 2 websites, and, so if they wanna check out the website, they could visit that, or you could just go to Apple or Spotify or Google Podcasts and just type in Save My Thyroid.
Oh, well, thank you so much, Dr. Eric, for being here and sharing all this really wonderful information with everybody. And I look forward to staying in touch.
Yeah, same here. Thanks again, Margie. It was great having this conversation.
I hope you enjoyed my interview with Dr. Eric as much as I did and now have a better understanding of hyperthyroidism and what can be done. All the links that he talked about, including the link to his book and his podcast, will be in the show notes. And he didn't mention that he does work with people individually, so you can find that on his website, which is also in the show notes. And make sure to download my Improve Your Bone Health Naturally mini course, where you'll be able to learn some great things that you can immediately put into your life to start working on your path to optimal bone health today. So thank you so much for tuning in, and I look forward to seeing you on the next episode.